Well, New York City is very much in the news these days with the outbreak of the coronavirus there, and very timely for us to have with us today Peter Pitts. He is the president and co-founder of Center for Medicine in the Public Interest, former FDA Associate Commissioner, and the author of a fascinating book called Common Sense Healthcare Policy for Common Sense Americans, and then in parentheses, and presidential candidates. Good. Thank you, Peter, for including those guys.
Well, you know, everybody can.
Good to see you. Thanks for your time. Can you describe things there in New York?
Well, things are tense, but I think we're all pulling together. It kind of has a post 9/11 vibe where we're all realizing that we're part of the solution, and we're social distancing, and we're sheltering in place, and we're getting a lot of tender, loving care, and we're trying not to go off the deep end.
Okay, from your perspective, Peter, how serious is this?
Well, this is a very serious situation. You know, the dangers are real. You know, people are going to get sick if you're older and at risk. The opportunity for more serious consequences are certainly there. And we have the ability amongst ourselves as a community to solve the problem. Clearly, there are going to be therapeutics that are going to come online relatively soon. In 10 months to a year, there will likely be a vaccine. But right now, to really beat this thing, we've got to take it personally and do the right thing. And I think that we're going to get there. I'm pretty optimistic.
So you think the way we're attacking it is good, the way it's being managed?
Well, I think that we're getting better. I think that we got a late start. I think this is something that we've never done before. Clearly, we're doing as well or as poorly as the rest of the world. I wished we had learned some lessons from the Chinese experience, specifically relative to making sure we had a proper supply of masks and gowns and testing kits and so forth, and hospital beds certainly. But we're catching up very fast, and we're going to beat this thing. No question in my mind, not at all.
So why weren't we prepared, whether it was this or something else? Why were we so low in medical supplies?
Well, we weren't low. We simply weren't prepared for this type of a onslaught of a new and unknown disease. I mean, I think it's human nature not to want to think ahead. It's like, as they say, the generals always prepare for the last war, not the one that's happening right now. But, you know, there's a great Japanese proverb that says, don't fix the blame, fix the problem. And I think right now we've got to go ahead, full steam ahead, and view everybody as an ally rather than an adversary. I mean, President Trump, for example, to my mind, one of his key tasks is to be the optimist in chief. And I think he's clearly now understanding he's got to follow very serious scientific and medical advice. And I think that what he's learning is he needs to be the cheerleader. You know, I'm all for that. But when it comes to talking about the science and the healthcare policy issues, he's got to let the experts do the talking, which is exactly what he is doing. And I would only hope that the media kind of gets with the program and starts reporting the news straight, because people really want transparency. They want to know what's going on. I think desperately want the situation to be portrayed as a public health situation as opposed to a political situation. And that's a hard shift from where we were 3 weeks ago in the heart of the Democratic debate discussions.
Yeah, no question about it. So where do you think the bell curve, where do you think the downside is going to be?
Well, I think that we're going to see a uptick in cases, certainly here in New York and around the country, likely for the next month. I suspect that we'll reach a zenith in nationally, maybe in a month or so, at which point we can begin thinking about what happens next. And, you know, one group that's really been ignored here are people that have already had the virus. So it's important not just to test to see if you've got it right now, but also to see if you've had it. If you've had the virus, the antibodies you've built up will give you a sort of immunity against the virus. And that's a cohort of people that can begin to get back to work, that can begin to help people that are being stressed because of a lack of labor sources, and also possibly the source of a vaccine, you know, in terms of antibodies. So I think that we're going to have to start thinking what happens beyond the virus, what happens after the virus is under control and beaten. And that's not just true relative to the economy, but certainly relative to public health.
Okay, I'm not sure if I can ask this next question correctly, so bear with me here. But given your experience with the FDA, can the rules be bent to accelerate a vaccine to be approved?
Oh, no question about it. They can, and they are. I was at the FDA during the days of SARS, and that's exactly what happened. You know, FDA and CDC and other branches of government partnered with private industry to bring these programs forward on a radically expedited basis. Now, there's a difference, though, between rushing it and expediting it and ignoring it. You can't ignore the need for sound science. You don't want the cure or the treatment to be worse than the disease. I think that's what we're doing right now. We're working with all members of the COVID ecosystem, as it were, to make sure these things happen, they happen quickly, and they happen safely and effectively. And it absolutely can be done.
So it looks like they're coming up with vaccines, but they don't know the side effects. And that does take time to prove out, doesn't it?
Sure does. And that's why you want to do clinical trials. I mean, we know how to develop vaccines. We know how to manufacture them. Neither is easy. But as you said, you also have to keep a very close eye on what happens once a person has been vaccinated. And there's no way to do that other than doing human trials, which is what's going to happen. You can't not do that. That would not be responsible.
Okay, we also have heard, now correct me if I'm wrong, that there are vaccine cures, or at least claims, coming in from other countries, Israel being one of them. Let's say it is a vaccine and it does work. How does it get through the FDA?
Well, there's a process where the manufacturer has to work with the FDA to look at the data, prove its safety and effectiveness, and also to maintain high quality manufacturing standards. And clearly this is a top priority. Nothing's going to come before it. So it's going to happen relatively quick once the science has helped us develop a vaccine that the FDA can actually even look at. Right now, it's a little bit cart before the horse because the FDA can't review anything. There's no data for it to look at. But they have to send a very powerful signal that once this data is available, they're going to make it top priority, and they're going to make sure it's done relatively quickly with a high degree of accuracy.
So are you confident we're going to come up with one? And then I know that they're looking at other medications that address other diseases that might apply here. How's that looking?
Right. Well, on the one hand, a vaccine is curative. That's a cure. It prevents people from getting it in the future. What's also on the docket are medicines that will help to alleviate symptoms and hopefully make the time frame between getting sick and getting well quicker. But the problem is those drugs are also just entering human trials, but that's going to be a lot quicker. I suspect that within 10 days to 2 weeks, we'll have a whole new toolbox of existing medicines that can be used to help people that currently have the disease. It won't prevent it, but it'll truncate the duration and help people with the symptoms feel a little bit better. But it's important not to, again, make the cure worse than the disease. You don't want to create artificial shortages. You don't want people to rush out and hoard these products that are currently available by prescription because, for example, one of the drugs is used for lupus and rheumatoid arthritis. You don't want those people who are using the drug now to be without their medicine. So again, there are a whole range of issues, not the least of which is not being hysterical and rushing out and demanding a prescription that you don't need.
One more quick question before I get to your book quickly, and that is, it appears that most of the manufacturing of the active pharmaceutical ingredients come from overseas, i.e. China. If we learn anything, we got to get that stuff back home, don't you think?
Well, I'm all for Buy American. I think that the more materials we can produce in the U.S., the better, unquestionably. But as you said, 80% or more of the active pharmaceutical ingredients, the API, is produced right now in China and India. Would I like to bring that back to the U.S.? I certainly would. A couple of issues. First is obviously they'd be more expensive. But secondly, we'd have to build facilities because right now the manufacturing of pharmaceuticals in the U.S. Is running at full tilt. There aren't idle factory lines waiting to be used for other things. So we've got to kind of look at the whole way these things happen and incentivize both the building of factories and the purchasing of American-made products. And that's something we have to look at seriously, again, post-COVID, because, as you said earlier, it is something we're going to need to understand and control when the next problem arises.
All right, less than a minute. Tell us about your book. What do you want the takeaway to be?
Well, thanks for asking. I think the key takeaway of Common Sense Healthcare is that we live in a complicated world. Politicians who are pushing soundbite solutions are pulling the wool over our eyes, whether it's Medicare for all or drugs from Canada. These things are complicated. And if it sounds too good to be true, it probably is. If you're hearing a politician running for office saying, I've got the answer, here's what it is, ask that politician, what are the repercussions? How it will impact America's drive for innovation? How it will impact the economics of drug development? And if they say no, I would urge people to send them a copy of my book, and I'll pay for it. Okay,
there you go. Check it out. Common Sense Healthcare, Policy for Common Sense Americans by Peter Pitts. CMPI.org is his website. CMPI.org is his website. Thank you, Peter. Let's stay connected. You're fascinating.
My pleasure. Stay healthy.
Okay, you too.